Yeah. Good morning, everyone. I do want to point out my swag this morning. So I've got Deaf Choice swag. Jay and Vicky, who are here with us every Wednesday, are from Deaf Choice. So thank you for the swag. I'm wearing it with pride all over the neighborhood. Thank you. All right. We're going to go through the numbers. And so as of today, our positive cases in Hamilton County are 10,663. Hospitalizations are at 1,042. And we have lost 281 people to COVID-19 in Hamilton County. The increases from last week on positive cases, the increase is 404. For hospitalizations, the increase from last week is 25. And the increase in deaths is 12. And if you recall, last week it was 11. So we're leveling off, but 12 people dying in this community in 1 week from COVID-19 is a lot. And Greg will dig into these numbers a little bit, but it's just a constant reminder that we all need to continue to wear the mask, wash our hands, and keep away from one another. So before we get to Greg for a deeper dive into the numbers, we're going to do a quick update on the census. And then we're going to have another announcement for an important initiative that we're launching regarding testing. But let's go to the census first. So here's where we stand. Hamilton County is at 65.9 cumulative self-response rate, down from 67.2 at this stage in 2010. This means a greater share of non-responding homes will need to be visited by census takers on the doors, an especially challenging task now that the Census Bureau has shortened the door knocking time frame by 4 weeks. This non-response follow-up will take place until September 30th instead of October 30th. But during this time, you can still fill out the form on your own online so that a census taker won't need to knock on your door. Go to my2020census.gov to fill it out today. Again, I've done it, takes about 5 minutes. If you don't want someone knocking on your door, then fill out the form, your name will go off the list, and they won't come to your door. So I would recommend that everybody jump on today and fill out your census form. It is so easy, and we desperately need to be counted in order to receive the federal support that we have been using throughout this pandemic, by the way. So Ohio has a 68.6 self-response rate, so a little bit higher than ours. And not that it's a competition, but we're doing a little bit better than Cuyahoga County. We're doing a little bit better than Franklin County, but Montgomery County's numbers are higher than ours. So not that it's competition, but let's go. Here we go. And let's talk very, very quickly about the neighborhoods. So the highest response rates are coming in from Mount Washington, Miami Township, Wyoming, and Greene Township. Mount Washington is leading the pack at 91.1%. Go Mount Washington. My chief of staff's from Mount Washington. He's taking some credit here. But anyways, way to go, Mount Washington. So if our lowest self-response rates are in Over the Rhine, Corryville, Cuff, and Queensgate. I'm from Cuff, and so I'm going to challenge my neighbors to jump on and get the census done today. Some of that is relative to the student population, obviously, but we have some work to do in those communities. So especially if you live in those communities, get on a census, fill it out yourself, and remind your neighbors that this is really important. I actually ran into a census taker. I was out dropping lit last weekend in Anderson Township, and I ran into a firefighter who is doubling as a census taker right now, and he said that he's getting a fairly positive response on the doors, but some people are a little irritated to have someone knock on their doors. And while I get that, the idea is to fill it out online so that doesn't happen to you. So again, my2020census.gov, fill it out today. All right, so before we go to the information related to testing, which is a new initiative that's being rolled out through the CARES Act dollars, I'm going to turn it over to Greg Kesterman so that he can run us through the numbers and the trends.
Thank you, Commissioner, and good morning, everyone. So I'm standing here today, and this is the 5th week in a row that I can continue to share positive news. People are continuing to wear their masks when they're in public, and many of the metrics that I'm going to go over here in just a moment are continuing to trend down. So thank you for everyone for your hard work so far, and I continue to encourage you, even with these positive metrics, that we continue to stay focused and do these things that we've been talking about for weeks, like wearing masks and social distancing. We'll start with the case numbers here in Hamilton County. When you look at our numbers for 6 weeks, we have seen a decline in cases. This graphic with the face mask on it really tells a great story. From July 8th forward, we have seen a decline in those number of cases. So to everyone who's been wearing your mask, I really appreciate it. And this is helping us while most businesses are back open, maybe not how they looked before the pandemic. Most businesses are back doing business, and we're able to see cases decline. So thank you once again for your hard work. The next graphic I'll show shows hospitalizations within Hamilton County. We are continuing to see hospitalizations within the county on a decline, as you can tell. When you look at the region, the 14-county region, which uses many of our hospital systems, we see the cases still elevated, but they have been trending down over the last week, generally speaking. In addition, intensive care unit admissions for the region continue to be elevated, but also a slight trend down in the last few days. Another positive sign for our region. With regards to deaths, as Commissioner Dreihaus just indicated, deaths are fairly low compared to where they were just a few weeks back. They are not perfect yet, but these do tend to be a lagging or a delayed indicator, so we'll continue to watch those closely. The reproductive number for the county is currently at 0.93, and for the 14-county region, 0.97. We're really working to try and get this number to as close to 0 as possible, but anything under 1 is a good indication that we're doing things correctly here for the region. And the final graphic that I have related to some of our numbers is the State of Ohio alert system. Here in Hamilton County, we remain orange, which essentially means that we are still on alert, and we know that while we're orange, it's important to remember that it means that there's still increased exposure and spread of COVID-19 in our community. We still need to exercise a high degree of caution here in our community as well. So orange is a great thing. It means that we're doing a good job, but we still can go yellow, and I guess at some point we could even go back to green, which means we've conquered COVID-19. Long way off, but I think that continued effort that we're all doing is very important. With each of these data points, we as a community should continue to be proud of our hard work. We've continued to see these metrics decline. So I think it's important to remember to continue to social distance, wear your mask, and keep sick at home. Also, when you feel sick, it's important to get tested. Commissioner Dreihaus indicated we'll learn more about the new county testing initiative in just a few moments. But today, there's an opportunity with the Ohio National Guard. They are doing some testing here locally. I can tell you last week we had low turnout. Anyone who showed up to get tested was tested within 10 minutes. There was very little wait. In addition, test results were returned quickly. I believe by the end of the week, many people had their test results. So if you're contemplating getting a test, I would encourage you to go today to get tested. Today's testing is happening at the White Oak Christian Church, located in Colerain Township on Blue Rock Road. Testing goes from noon to 4. Once again, I mentioned last week there is very little wait, so if you're interested in a test, this is a free opportunity to get tested. So in conclusion, just remember, we as a community must continue to work hard in keeping us going in the right direction. I keep saying these same basic principles, but wear a mask. We want to social distance. We want to stay home if we're sick, and we want to treat those around us with respect. I think we are heading in the right direction. I'm very proud of the hard work that everyone is doing, but please don't let your guard down as we continue to move into fall. I appreciate everybody coming together and doing a great job. Thank you.
Thank you, Greg. And now I'm pleased to welcome Brittany Punches. She's coming to us virtually. She's a PhD. Brittany is an RN and assistant professor at UC's College of Nursing. Good to have you with us. I see you up on the screen. This morning we are excited to announce a major initiative to ramp up testing in Hamilton County. Test and Protect is a partnership between Hamilton County, the Health Collaborative, and 8 organizations you know and trust to deliver safe and reliable COVID-19 testing to those neighborhoods and organizations that need it the most. So the logo is up on the screen, and you can see the great partnership amongst all those organizations that are listed there. So Test and Protect aims to help stop the spread of COVID-19 to better protect the health of all people in Hamilton County. Hamilton County has awarded $18 million of the $142 million that we received from the federal government through the CARES Act funding. This means 175,000 tests from now until the end of the year will be administered. Testing is critical to the overall strategy to minimize the spread of the virus and keep our region open. But this testing is a little bit different than what Greg just mentioned, which is the pop-up testing that we've been doing. So Brittany, Dr. Punches with UC College of Nursing will go into more detail here, but Hamilton County has partnered with the Health Collaborative and their partners as we have regional surveillance across the region that can pinpoint where there are spikes and hotspots in our community. Hamilton County Cares COVID-19 testing is now open for business and organizations ready to take requests on outbreak mitigation that is needed. Bridget, do we have another slide coming up? Okay, I'm going to keep going. So the idea here is that we are trying to better understand some of these congregate settings where people are most vulnerable near one another and where the spread increases if someone gets COVID-19. And so if you're a business, if you're a nonprofit, if you're a congregate setting, and you would like to have this testing come to that space, that this program is for you. And so the Health Collaborative will be coming out if you call them and ask for this assistance. So their website is healthcollab.org, and the hotline is 513-618-3656. And now for more detail, it is my pleasure to introduce Dr. Punches to provide more context. Good morning.
Morning, and thank you, Commissioner. We're launching the Test and Protect project that is really designed to help Hamilton County residents and employees who are most at risk from complications of COVID-19. So these partnerships that you just mentioned will work to combine the most advanced data analysis methods and community-focused approaches that will bring testing to the people that need it the most. So our team will be bringing boots on the ground, testing people who are over 65, frontline workers, and vulnerable individuals who might live in those congregate settings that you mentioned or have other medical or disabling conditions. Our partnerships will also work with organizations within Hamilton County, like you mentioned, who need assistance to protect their staff and the individuals that they serve. This could be those residential facilities, fire stations, public transportation, grocery stores, or other places of employment within Hamilton County. We intend to assist our community and these organizations with a gentle approach to overcome this pandemic. Our mission is to really quickly identify the people that do have COVID-19 so that we can keep our most vulnerable safe. These advanced scientific methods and the most up-to-date public health guidance will also respect privacy and go directly to the people who need the testing instead of trying to find us. We're really just grateful for this opportunity to serve those people who are most at risk from these efforts from Hamilton County. Thank you.
This is a really great initiative. We're very excited about the collaboration, but also excited to make sure that testing's available in the most important places in Hamilton County, really. It's very strategic and very targeted. So thank you to the Health Collaborative, all the partners that were up on the screen for helping us with this initiative. And thank you, Doctor, for being with us this morning. We're very excited. So just two more things before we go to questions. Just two reminders about some of the things we've talked about in the past. So the small business assistance program went live on Monday, and so it's a 2-week time frame, remember, to apply for that. The criteria has been changed. We are expanding the program to allow more businesses to apply and be eligible. So even if you didn't qualify in the last round, please apply again. If you receive PPP under 20,000, you can still get assistance. If you had a reduction that was 15% year over year, a reduction from COVID-19, you can apply and be eligible. So please apply. We are trying desperately to help as many businesses stay open in Hamilton County as we can. In the last round, we helped about 220 businesses. We are looking to expand that number. So please apply. Go to the Hamilton County website, hamiltoncountyohio.org, and there is a button there, Small Business Assistance. Click on that, and the application is fairly easy. We've actually simplified that as well. The other thing is that our nonprofit program, the application period has been extended. We heard from folks yesterday that we're really having a hard time meeting that deadline, and it was a short time frame. And so we're extending that deadline until Monday. So if you're a nonprofit and you too have had a reduction because of COVID-19 in your resources and have a greater need, please contact the county and apply for those dollars. So with that, Bridget, I think we're ready to go to questions.
Thank you, Commissioner. First up is Mariel Carbone from WCPO. She has questions for you, Greg. Regarding best practices you recommend for back to school. We'll let Mariel ask her question.
Great.
Yeah,
Thank
so
you.
obviously, hi there. This week a lot, and I guess the end of last week, some of the in-person learning was starting in school districts all across our counties. And a lot of these schools have different measures in place, masks, some of them are doing different types of cleaning. I've heard about actual like sneeze guards on desks. So is there anything you would say are the most effective steps that schools should or can take right now?
The absolute best practice for the school is to try and give as much space as possible between students. I realize in our county we have, I believe in my jurisdiction, which is Hamilton County outside of Cincinnati, Norwood, and Springdale, we have 178 schools. And so each school and how they're coming back is going to look different. On the other side of it, though, I would say families really need to spend time talking to their kids about masking. We know that all schools are requiring masks because it's a mask mandate. I think it's important that parents talk to their children. Make sure that the parents are expressing their support for the masking requirement. Talk about the importance of how the masks can help keep their kids and their families safe. It's a hard challenge. I know younger kids, it's more difficult, but the more comfortable kids are and know that their parents are supportive, the better off those children will be. The other thing I want to encourage families to do is to really pay attention to their child's health. You know, this school year is different than any other school year that any of us have lived through. So we want to pay attention when our child has symptoms that are a bit unusual. And those are the days, even though it's a struggle, if we have jobs to go to, we want to keep our kids home on those days so we're not spreading COVID-19. And then the last thing I'll share, you know, this year as we're sending our kids back to school, this is their first time in a school building in 6 months. And so that can be challenging for our kids. So we just want to make sure we're talking to our children and making sure that they feel supported as they're adjusting to new social norms, a new way the classroom looks, and really COVID-19 in this new environment.
Two other quick follow-ups on there. You obviously mentioned masks. Is there a certain type of mask you would say are better for kids? I know that last week there was kind of some discussions over which ones work the best, but obviously kids thinking about taking them off or pulling them down. Is there one that you would say are best for in school?
Generally speaking, any of the cotton masks that cover your nose and mouth are very sufficient. Surgical masks work as well. There was some new research about gaiters. I've only seen one study. At this point in time, we are just encouraging everyone to wear a mask, and children are supposed to. When you think about the school environment, we did also see a shift last week where face shields were at one point considered something as an option. They are no longer considered an option, so we have to go with the masking.
And just last question, sorry.
Just for clarity, the gaiters are, they almost look like scarves. They go around your neck and you can kind of pull them up.
Awesome. And just last quick question. I don't know that we've seen any of the spikes really in any Hamilton County schools just yet, but we've seen some of the other schools having to quarantine a lot of large groups of students. Is this a concern for you that we're going to start seeing spikes in cases again?
We are absolutely concerned and keeping a very close eye on our schools. And you've heard me over the last several weeks talk about some of our planning. We've worked with our school districts and our schools very closely on creating their plans and making sure they felt supportive. But more importantly, now that students are back in schools, each school has an individual that's been assigned to them. So if we hear of a child that's sick, whether it's COVID or not COVID, the school district or the school has access to one of my team members that can provide quick information and help them make the decision on if that child should be isolated, if that child has COVID potentially, what they need to do, and to make sure that they're doing the best they can to help keep the entire class and the entire school safe.
Awesome. Thank you so much.
You're welcome.
Next up, Jay Hanselman has a couple questions for you.
Great.
Good morning, Greg. A couple of quick follow-ups on the testing question. I know of one employer that is telling employees that if they have a positive case of COVID-19 to return to work, they have to have 2 negative tests 24 hours apart. If all employers go that route, is there enough capacity to handle that kind of testing?
So the Centers for Disease Control, I believe about a month ago, changed their recommendation. At one point early on with the pandemic, they actually offered 2 solutions for getting back to work. One was the test-based solution that you just shared. The other is a time-based solution. Right now, the CDC is recommending that everyone utilize the time-based solution for getting back to work. And what that means is essentially if you test positive for COVID-19, you are isolated for a minimum of 10 days from the beginning of your symptoms, or if you don't have symptoms from the day you test, you have to stay home at least 10 days. You might have to stay home longer if your symptoms go all the way to the end of that 10 days. You have to be symptom-free for another day before being allowed to return to work. I would actually encourage employers to follow that particular process that the Centers for Disease Control recommends.
So just to be clear, that means there would be no tests needed to return back to work.
That is correct. And sometimes a positive test at the conclusion of your sickness will still occur, but it doesn't mean that you're able to spread the disease. So that's why the Centers for Disease Control, as they learn more about COVID-19, made that shift to a time-based strategy as opposed to the test-based strategy.
And just one other, this may be for you, or it could even be for Brittany. You were talking about the testing that the county is going to do with the Health Collaborative, and you focused on like first responders, frontline workers, people in congregate settings. So does this mean the county will not be doing like the individual testing that we've seen through the National Guard with the pop-up testing, or is that also included in the Health Collaborative's plan?
I think I'll let Brittany take it, but can follow up with any additional questions.
Hi, yeah. So this is in conjunction with anything that would be occurring through the National Guard. I believe that those efforts will be coming to an end soon, and then this will make sure to cover any efforts that were done by the National Guard.
But would you be, I guess, would there be, if the National Guard ends up pop-up testing, is this something that the county is going to fill in for individuals who may want to be tested?
Correct. Yeah. So anyone that would want to be tested would be able to receive a test through this if they were eligible, like the Hamilton County residents or employees through Hamilton County.
All right. Thank you.
Thanks, Jay. Next up, we have Chris Wederick from the Business Courier. He has questions about the new testing for either you, Commissioner Dreihaus, or Dr. Punches.
Okay. We'll listen to the question first and decide.
Sounds good. I just want to understand a little bit more about the new program. I mean, are you guys going to be seeking out organizations to test, or is it dependent upon them calling you and saying, "Hey, we have a congregate setting and we need you to come in and test us"?
So actually both approaches will be taken. So there will be on our website, you'll be able to enter into the intake form if you want to request testing for your organization. But then also with the data that's coming through, we'll look for communities that we consider hotspots that we would then partner with the local organizations in that community to bring the testing to where the people are instead of having them come to us.
I know that you mentioned like nursing homes and those types of organizations. Are there other examples that you would give?
Frontline employers are really what we're, or frontline employees, but also like homeless shelters or maybe sober living or things like that could also all be considered.
Okay, so
is housing complexes. And some of it is related to individual structures or organizations or businesses but some of it's related to communities, as was just alluded to. So we have hotspot communities in Hamilton County, and so making sure that that community has access to testing is really important, and that's part of the push right now too.
Okay, great. And I'm sorry, Denise, is this designed to, I mean, at this point, I feel like everybody who wants a test can get it right now. How much is this going to, I mean, is that going to increase even more with this, I guess is my question.
Yeah, well, when we were doing the pop-up sites, other testing sites were available. I mean, and again, they're available on the public health website. And so even though those were available broadly and generally, the pop-up sites were wildly popular, as you know. And so they're also free and they're pretty quick, depending on the day. And so I think people, when they know about a pop-up site, tend to go, and we want them to go. We want them to get tested. And so while there are clinics all over doing this testing every day, I think people are drawn to the pop-ups, and so that's why they've been so successful. So, I think we still need to continue to go down that route.
And do you feel that, one other question on this, and then I got one for Greg as well. Do you feel that you've eliminated the lag that some people anecdotally reported where they were waiting a week or more for their test results, which kind of defeated the purpose of that? Is that generally over at this point, that problem?
It is, and I am going to let Greg elaborate. We had a situation early on that has been taken care of, but Greg is intimately familiar with that.
Certainly. So with regards to the pop-up sites, we have worked with our partner, the National Guard, to make sure that they are shifting and utilizing labs and making sure they're communicating the number of tests that they anticipate. By doing so, we're able to make sure that the tests are going to a lab that has capacity. And what happens then is we see a much quicker turnaround time.
And then, Greg, I have one question for you. The New York Times was reporting last night that the CDC had basically changed its guidelines on testing asymptomatic individuals and basically said not to do that. What do you make of that guidance, and is that something the county would follow?
Generally speaking, if you've followed this press conference, my guidance has been if you feel sick, I would like you to stay home. In addition, get a test. Asymptomatic people are able to get a test in Ohio. We have seen some states pull away from testing asymptomatic people, partially because of a capacity issue. The focus really needs to be testing those individuals that either are exposed to COVID-19 or have symptomology. When you look at the new $18 million initiative that Hamilton County is putting in place, it's really based on this science. We know that if we can quickly find out who has COVID-19 in a workplace, we can quickly isolate those individuals and hopefully keep business going. Our goal is to not shut down the entire economy again, as the state of Ohio did early on in the pandemic. Our goal is to use more of a laser precision and pull out the pieces when we know that there are individuals that are sick and make sure that we can keep things going again.
Thank you.
Thank you. Hannah Sparling with the Inquirer had a question about the new testing program, if it wasn't already covered. Hannah, do you still have a question?
Yeah, I do. Thank you. So I'm wondering, with the new program, it's just for, like, it sounds like businesses or groups, and an individual would not kind of fit into taking part of this. And then is the plan, like, will you go to the business and test employees at work, or you go to the home and test the people who live there where they're living? Is that kind of how it works?
I'm happy to take it. Either way. So multi-faceted testing opportunities. You've heard a little bit about the ability to go to a business and bring testing to those business locations, but there's also community testing built into the plan, very similar to the National Guard testing. This plan is really just trying to make sure that there's good access throughout Hamilton County this fall to testing, so when people need tests, they're available.
I think you said 170,000 from now through the end of the year. Is that just going to be kind of first come, first serve wherever they're needed?
That is kind of the estimate built into the contract, and they'll be working through that throughout the remainder of this calendar year.
Thank you.
That appears to conclude our questions from reporters.
All right, very good. Yeah, Thank you for the questions related to the testing program. We're really excited about it. If you've got continued questions, please feel free to reach out. Again, it's going to be data driven. You know, we're going to look at hotspots, look at where we need that testing specifically, and move into those locations to make sure that there's access to testing, just as the health commissioner said. So anyway, thank you all for jumping on. We'll be back next Wednesday. Have a good week.